Good afternoon, everyone, and a warm welcome to our doctor and everybody present here. We are here to discuss an issue that's extremely important but not openly spoken about. MSSI is taking a big leap today and has chosen to talk about impact of MS on marriage, pregnancy, and intimacy. The youngsters and the couple dealing with MS rarely has an example to follow. So that's why mostly these topics are not spoken about. And it is important to talk about issues that are considered to be, just behind the doors. So we have come here together. Thank you for joining us for this very important topic. And what I think is communication is the key. So MSSI today has, and the National Youth Wing has today taken this leap and decided to speak on impact of MS on marriage, pregnancy, and intimacy. So before we start, I would like to call Mr. Sanket Mistry, the MSSI National Joint Treasurer and Coordinator for the National Youth Wing, to tell us a little about what MSSI is about and the National Youth Wing. Over to you, sir.
Okay. Good afternoon to you all. I think today, that is the 12th of January, is the National Youth Day. And I, Sanket Mistry, as Pyle introduced, I'm the MSSI National Joint Treasurer and also the coordinator of the National Youth Wing. I welcome you all for this webinar on behalf of MSSI and our very own newly formed National Youth Wing. Now, before we start the webinar, let me brief you a bit on the National Youth Wing, that is the NYW. So NYW has been formed for our young persons with MS whose age is below 40 years and who would like to contribute towards the MS cause and would work on national projects. And our national projects are broadly classified into three categories. One, obviously, is the awareness and advocacy. The second being the rehabilitation and livelihood. And third being the fundraising. Now, so if you have the passion to work for the benefit of other persons with MS, and also what we call in as our co-friends, so you can please approach your chapter heads and join our National Youth Wing. Now, I think without wasting much of your time, now let's start with this webinar, wherein our National Youth Wing team has chosen a very bold topic, that is impact of MS on marriage, pregnancy, and intimacy. Over to you, Bhai.
Thank you, Sanket, sir. And now I would like to invite Merin to introduce our guest speaker, Dr. Jaydip Chaudhuri. Over to you, Merin.
Hi all, it's my pleasure to introduce today's webinar speaker, Dr. Jaydip Rai Chaudhuri, MD, DM, MNAMS, FEBN, MRCP, Neuro UK, FRCP. He is working as head of the Department of Neurology, Yashoda Hospital, Somajiguda, Hyderabad. Dr. Jaydip is interested in treating complex neurological disorders like multiple sclerosis and neurological rehabilitation. He is a fellow of European Boards of Neurology and fellow of the Royal College of Physicians, Edinburgh. He has published original articles in peer-reviewed national and international journals and worked as a principal investigator in many international trials, which included trials for disease-modifying therapy for multiple sclerosis. Hi, Dr. Jaydip. Welcome. The screen is yours.
Hi. Thank you, everyone, especially the MSSI and National Youth Wing for inviting me to talk on a very touchy subject of sexual issues, intimacy, and pregnancy in this complicated disease of MS. Yes. Yeah. So I was told that there are many queries and questions that are there in this domain from patients or from people who suffer from MS. And so these questions, some of the questions are shared, and then that's a plan that we thought that we'll address each of these questions one by one and try to see that whether some clarity is available. Yeah. So as we all know that multiple sclerosis is a disease that affects different parts of the nervous system. from the eyes, in the brain, spinal cord. And so wherever the lesions are, people and the patients have the symptoms according to the lesions that is present. And over time, we saw that some of these symptoms do improve, and sometimes we see that the symptom doesn't improve completely. Initially, in the stages of MS, the symptoms tend to do better, but over time, as the disease progresses, the number of relapses increases, the disability starts accumulating, and patients develop a lot of other different types of disabilities. One of these disabilities that is very important in our day-to-day life, and specifically it's for the young people, is the sexual problems and sexual dysfunction. And as we know that usually multiple sclerosis occurs in the early ages, in around from 17, 18 onwards, though there are cases of pediatric MS, but still it is usually happens in during that time and the productive time and the reproductive time of our life. So sexual problems do play an important role. And many articles across the world literature, we find that sexual dysfunction usually affects 90% of the people who are suffering from MS. So it's a huge one. It's not in 10% or 15%. It's significant. So that's it. There is sexual dysfunction in 9 out of 10 patients who have multiple sclerosis. So the prevalence of this problem among patients with multiple sclerosis is huge.
Thank you for this brief introduction about the topic that we are discussing. Hello, doctor, and a very good evening to everyone here. So we had asked questions to our fellow MSPs around India, what they have queries, and we have come up with few questions. So I shall share the questions and the doctor is going to answer that. Okay, so my first question to you is, doctor, does MS have a direct correlation with sexual desires?
Sexual desires and MS, it doesn't have a direct correlation with desire. Desire is something, a different issue, but obviously because of difficulty in the body parts, that is walking, urinary bladder control, leg weakness, and recurrent attacks, and basically fatigue. All these causes lack of desire. So inherently lack of desire is not there in MS, because the desire centers and all are multiple in the body, and it's not directly get involved with MS. But definitely fatigue is very important, and fatigue is the most important part that causes issues in having desire for sexual intimacy in MS. Yes, please.
Are there cognitive strategies or therapies that can assist couples in managing both mental and physical challenges and maintaining a healthy relationship?
So basically your question is that what are the cognitive strategies we can have in maintaining a healthy sexual relationship? Yes. So we'll go one by one. Let's go talk about the male. Men usually have erectile dysfunction and they have ejaculatory dysfunctions. And with that, basically, they will also have leg. This usually comes when there is leg weakness, urinary bladder dysfunction, and when they have a significant disability. So in men, we found that basically the sexual dysfunction starts happening. There's this erectile dysfunction and ejaculatory problems when they are little disabled, when they are not able to walk or they have urinary issues. And sometimes they will be all also on medications for different reasons, and sometimes those medications also can contribute to the problem. Well, women probably usually suffers from anorgasmia, so that is the lack of orgasms during sex, and reduced vaginal lubrication. These are the most important complaints that women have, and also they have reduced libido. The problems in women doesn't correlate with their disability. So women who have a mild disability, they may have sexual dysfunction. That is against the men. Men will have significant disability and have sexual dysfunction. But in women, we find that this problem happens when they have less disability. And they also, and also this disability comes with fatigue. That is more common in women than in men. And and so that is also to be addressed. And these medications that people use during MS for different reasons can also contribute to having sexual issues. So cognitive strategies will be that let us define the sexual activity more broadly. That always we think that it's a penile vaginal intercourse. That is the only sex. Uh, uh, the papers and the psychological counselors across the world have suggested that yes, that may be one of the most important thing. But the thing is that let us define the sexual activity more broadly, not only the penile vaginal intercourse, but probably massaging, kissing, petting, flirting, touch, sensual touch, and mutual sensual pleasing. These are also may be involved in and included to improve the sexual life between couples who are suffering from MS. And also, it is important that the sexual activity or intimacy should be done when they are in having activity, maximum energy. I mean, the physical energy is good. Maybe in the middle of the day or maybe in the morning hours, other than in the evening or night when the energy is come down. And during sexual activity, taking breaks often helps. So these are the important strategies, simple strategies that we can suggest for couples for cognitive strategies, if you call them. We can suggest for having a healthy sexual relationship.
Next question. This is
Next question would be about, yes.
On the women's side,
Yeah.
a pelvic floor or the vaginal dryness is
Yes.
common in women with MS. Can you
Yeah.
suggest some treatment plan to overcome this?
Yeah, it's very common, and that is probably one of the reasons for sexual dysfunction in women. And it can be actually addressed easily by using some lubricants and moisturizers. Sometimes vibrators can also be used if appropriately. These loops can be obviously used whenever required, and it doesn't have much side effects except allergy. It doesn't have any other issues by using adequate amount of lubrication, because that is the only issue. Sometimes pelvic floor exercises also do help. So with the help of the physiotherapy, one should learn how to do it, and it's easy exercise, and this can be done. So along with using of appropriate lubricants and doing a proper pelvic floor exercises or Kegels exercises, these things can be tackled.
There are articles regarding using loops to solve the above issue, as you just told. Does using loops regularly have any side effects? And not even loops, even the vibrators for that instance?
There is not much of any side effects recorded, except if you are allergic to those loops, there is an issue. And then if someone is allergic to a particular type of loop, they should read what is there in that loop. There are many types available, and then you can change it to another one if it is not helping. Except allergy, doesn't have a thing. And better not to use a very old loop that can get infected. That's also things that should be, and better to use it quickly and all once it has been bought.
Okay. Could you provide insights on managing the difficulty of achieving orgasms in individuals diagnosed with MS?
Yes. Yeah. So orgasms and MS is an issue that women do complain. And basically, there are two types. One is that this anorgasmia can be because of reduced vaginal lubrication. And because reduced vaginal lubrication, they don't get the pleasure. And at the same time, it can be painful. And so it can itself, the reflex feedback can decrease orgasms. So it can be that if that is the problem, it can be just simply managed with using lubricants. But another possibility that coming from the cognitive level of having orgasms is fatigue. Now, fatigue in women may be of different reason. We have to check if the person is using loops and still not able to achieve orgasms. Then we have to see that whether she is having fatigue or not, number one, and if the fatigue is there, why. So the challenges for treatment of fatigue is OSA. If someone has OSA, that is obstructive sleep apnea, when they snore in the night and sometimes they get up when they sleep. So these are the signs of obstructive sleep apnea. Now, if that is so, then a proper sleep study can be done, and sometimes by treating by using some respiratory masks or helps, or sometimes just weight loss can also help, because most of the time weight loss and OSA go together. And we should ask the patient that if you are getting fatigue, try to conserve your energy. So don't lose energy for doing unnecessary reason work, and be little aware that better to conserve energy. So suppose you have to do walk or climb stairs, don't unnecessarily climb stairs, go back, go use a lift or some other modes. Yoga do help, and aerobic exercises. These are the two very important part of treatment strategies to decrease fatigue, and reducing sedative medications, because sometimes people do use medications for lack of sleep, for numbness, tingling, and all these medications have the sedative effect, because people with MS do have numbness, do have tingling, do have electric shock like feeling, and they have sleeplessness, insomnia, and maybe mild depression also at times. And all these things we tend to treat with medications, and these medications have side effects of sedation. So once the fatigue is too much, one person can look into the medications once again and see whether titrating down the dose to some extent help or not. So that can be thought of and addressed too. Yes.
Okay. Next question.
I hope I am clear in this.
Quite clear. Quite clear.
Yeah.
There was this one connection question with the connection with this, that if a person having tingling and all, can they use, is it safe to use the loops and vibrators? Who's having tingling?
Yeah. It has tingling and numbness in the legs are because of something else. Lubricators and vibrators have nothing to do with that. That is different. They can definitely use.
Okay. Oh, this is a little different. If both parents have MS, what are the genetic possibility of next generation getting MS?
Yeah, so one thing we should understand, that MS is not a genetic disease. It's a sporadic disease. So there's no genetic probability to get MS. But it has been found that this HLA-B, HLA-DRB genotype, that HLA is one of the genotypes that is there in all of us, A, B, C, D, and all. So this genotype, this particular DRB1, is seen in 30% patients with MS. So this genotype increases the risk of developing MS. So if both couples, both of them have this genotype, then the chance of an offspring chance of getting an MS will be higher. And similarly, HLA-A02 found to have reduced, decreased risk of MS. So if one of them is having that and one of them is having this, then the chances comes down drastically. So that is the only thing one can look if they're both persons are getting married, is that what is their HLA DRB1 and how much is their HLA A02. These are the two important HLA things. And then with that, they can go to a genetic counselor and ask for the probability. But as such, it's not a genetic disease.
Okay. I think you have discussed about the erectile dysfunction.
Erectile dysfunction
First
we have
question.
discussed, but how to go about in a male we have not discussed. There was a question to ask. People have asked that.
So
how can we go ahead?
The question was erectile dysfunction. Yes. In men,
so
what you'd suggest, any treatment plans for
yes,
erectile dysfunction and premature?
Yes. So one is that we can use this Viagra type of medications, the phosphodiester inhibitors. This works very well. So if there are no gross cardiac side effects, one can use these phosphodiesterase inhibitors. Other things are that constriction bands and rings that are available can be placed in the base of the penis, and that helps to maintain erection. And if these two are not possible, then probably a urologist opinion can be taken. And there are there can use vacuum erection devices, intraurethral suppository use of alprostadil, or penile injection of vasoactive medications. So all this can be done by the urologist. If one have problems and it's not responding to the first two things, that is phosphodiesterase tablets like Viagra that can be taken prior to sexual activity, or by using constrictant band, these can be easily available. Other three are little surgical procedure or some intervention, and that can be discussed with the urologist and the neurologist, and one can use it.
Okay. How can one deal with urinary incontinence in an intimate relationship?
Yes. So that's a problem, and it's not. It can be addressed by little common sense only. Better to pass the urine prior to an intimate relationship if someone is not able to hold urine for a longer time. So that is one of the simple way to go ahead. Now, if a person has an urinary incontinence intermittently, I will ask them to check with them how much is their urinary volume remaining after they pass urine. That can be checked with an ultrasound. So that is, we call it residual volume. So suppose one passes urine and check with an ultrasound, and they found that it is less than 100. Then it's not a very big problem. And it can be some tablets like mirabegron can be used, and this mirabegron improves the bladder tone and all, and prevents sudden urinary leakage during sexual activity. But if someone has more than 100, then probably the mirabegron may not work. And then what people suggest that, yes, you can do a self-catheterization, clear your urine that is residually there in the bladder, and then go ahead. So with the sexual activity. So before sexual activity, if the urinary leakage is very much severe, one can use a catheterization, remove the urine, and then participate. Or this mirabegron is another tablet that helps if the problem is not so severe. In resistant cases and all, this intradestructure injections of onabotulinum can be given. That onabotulinum is not available in India now, but maybe it will be available very soon. People can use this injection inside the bladder. The urologists give it. It's not a very difficult problem. So it can be taken care of.
If an individual gets MS in early stage of life, say pre-marriage, and if they want to have kids later in life, then what is the drug of choice, DMARD, which they should be put on such so that they could be continued even during pregnancy without any side effects?
Yeah. And so the question was,
if someone gets MS in the early stage
yes,
before marriage.
so let's go ahead with pre-marriage. Suppose pre-marriage, someone is having mild MS.
Yes.
So those patients who have mild MS can be treated with glatiramer acetate or interferons or dimethyl fumarate. These are the three disease-modifying drugs. There are simple ones, and we can start them on if they have a mild disease pre-marriage. If pre-marriage the disease is severe or aggressive and moderately severe, then probably we'll like to give a powerful DMT, not the simple ones, and we may like to give rituximab, ocrelizumab, or ofatumumab. So those like that we can go ahead. It is pre-marriage thing. Now coming after marriage. So after marriage, I usually go like this, that I ask the patients that whether they are planning for pregnancy or not. So they will tell us, fine, we are not planning for pregnancy. Then it's depends upon, it's a mild disease, we'll continue the smaller ones. If the disease is severe, recurrent attacks of MS are happening, we'll go for a high efficacy drug. Now, but if you are going for a high efficacy drug, I tell them that if you are not willing for pregnancy now, please use a proper contraceptive. That is very important. If you are not using a proper contraceptive, having accidental pregnancy may cause a lot of unnecessary issues. So the couples has to decide if they're telling that they don't want pregnancy, and we will ask them to use appropriate uh, good contraceptives after discussing with the gynecological colleagues, and then give the whatever the drugs that is required for that person. But if they come and tell me that no, now I am planning for pregnancy. So yes, when they are planning for pregnancy, if they are using high efficacy drugs, we have to stop them, and And then options are that if the last relapse has happened more than 12 months back or more than 2 years back, then we can stop it for some time. And once we stop it for some time, we can plan for pregnancy and don't give any medications at that present moment of time. But discuss with the patient, we discuss with them that yes, in between we are stopping because you are planning for pregnancy. Sometimes a pregnancy can help in preventing relapses during during pregnancy. The number of multiple sclerosis relapse comes down. But if the relapse happens, yes, we may have to give you again high dose of 5 days of methylprednisolone and treat you. So that's a way to go out. Now, if the person is having mild disease and doesn't want to stop medication, they can continue with glatiramer acetate or interferon weekly once injection, and that is relatively safe during pregnancy. Dimethyl fumarate also is safe. We have some couples who have got pregnant and they have a good outcome without any problem with the dimethyl fumarate. But I usually stop the dimethyl fumarate as soon as there is conception. I tell them, you please stop now. But if the disease is very aggressive, then there is a problem. Then my plan is that either give rituximab and then ask them to plan a pregnancy after 2-3 months. And then if there is another relapse during pregnancy, I will give 1 dose of IV methylprednisolone, or maybe after 4th, 5th month, we may give another shot of rituximab if need be. So that is a complicated part. Very rarely we encounter that. That is where I manage the pregnancy. It can differ in between different doctors, but this is more or less the way we go out. And so there are options available for couples who get married and want to have pregnancy. It's not so difficult. Just a little counseling, detailed planning is required so that things can be addressed easily. I know it is complicated part. I know it's a complicated part, and
it is very complicated because end of
let
the
the doctors, yeah, let the treating neurologist decide how to go about. But there is a plan available. It's not that it is out of the blue.
It is definitely a plan available, but what happens to the woman's body end of the day? That is what is a big question, because
no, it doesn't. Pregnancy is not so harmful for MS, and nothing happens wrongly. Only appropriate timing and medications has to be used.
Definitely, sure.
Yeah.
In your professional opinion, what additional resources or advancements could significantly improve the quality of life for couples with MS?
Yeah, so basically, couples with MS should understand that yes, MS is not a fatal disease or anything. It's a disease that can have a little bit of unpredictable course, but with adherent to proper medications, we are seeing, and we have very good medications available. Life is not so bad. So, so to keep mental tranquility is the most important thing. What I feel, they should be calm and they should be not be so much worried about anything. And if any one of them is smoking, they should stop smoking. They have to control obesity because people walk less, MS people, and they tend to become obese. They should take vitamin D in correct quantities and avoid vitamin D deficiency. They should also avoid recurrent viral infection, basically the Epstein-Barr virus. That's good to avoid crowding and use masks because too much of viral infections are around in crowded places. Have a consistent diet. The diet should not change very dramatically, taking this diet, that diet, Mediterranean diet, this that diet. There's no MS diet available. So stick to your diet, that is important, because probably microbiome plays some role in the immunity and in MS. That is not very clear what is there, but better to stick to some consistent diet. And to avoid depression, anxiety, and if it happens to take treatment, go to the neurologist and ask them that I'm having depression and or anxiety. Better to treat them and avoid very high cholesterol food, because that increases obesity, and high cholesterol is not good for MS. And all these things, if you follow, your moods will not swing. So mood swings are also not good. If the mood is swinging too much, then probably we can take some medications. And if the patient or any of the couple are hypertensive, the hypertension should be treated. So these are the treatment plans, and if these are the resources, if you ask me, if you have these resources and follow it properly, things will be good.
Okay. So our last question, what would be the correct way to explain this condition to our future partners and their family about this condition? What would be my partner's role with respect to this after marriage?
Yeah. So, so this is the way how I will tell that better whether someone is going for marriage or not, to hide any information. They let them know what is there, and have open discussions about that. Yes, we have MS, and this is my I am having mild disease. I am taking this, and while I have moderate disease, I am having this, and this is the problem. I have a little difficulty in walking or something. We should tell the opposite side clearly, so that there should not be any problems later on. And now every lot of literature is available in public domain about MS, life in MS. Societies are there in MS in most of the states. So if someone is interested, they can go to the people in the society, talk to them, and or read about it, and try to get knowledgeable on this, and go ahead. So basically, to read about it, get knowledge, and not to hide information is my way to tell.
Thank you so much, doctor. It was quite an eye-opener. And yes, thank you so much for answering our lovely and unanswerable questions.
Actually, there is this one question, like this person, like he or she have MS and AS both. His father and brother both are HLA-B 27 positive. Does the possibility of progression of MS and or AS change? That's a question. So
No, I think the MS is a different disease. An ankylosing spondylitis is also a different disease. They have different mechanisms. So each one will have different sorts of disability, but it will not interact with each other.
Sir, it was quite insightful. Thank you so much. And the thing that you said at the end was not to hide the information. That is something that all of us should understand, and do not hide your problems. And because forever you may know that you there are solutions to it. If you don't ask for the solutions, you won't find them. And the questions, the answers that you gave for all these questions were quite important and necessary for all of us. Thank you so much, sir, for covering the most important and crucial topics of our life that most people are not comfortable talking, but would like to know the answers to. So thank you so much, sir.
Thank you very much for inviting me here.
I would like to request Mr. Arun Mohan to please give the thank you note.
Yes, good evening all. First, it was awesome. Thank you so much, Doctor. It was so enlightening, so positive, and it opened a lot of eyes. There was a lot of misconceptions which are there behind everybody about yes, it could happen. No, it's wrong. Yes, it's right. And you clarified everything. So thank you so much. Thank you really
Welcome.
so much for the clarity that you gave us, and especially when we took up this topic to be discussed, we realized that since MS affects the youth the maximum, these are doubts that they have in their mind, but they don't want to know. They don't want to ask anybody and everybody about it, because it's like log kya kahenge, what will people think, what will people say. So they keep their questions in their head and sulk about it or think about it. That's about it. But I think this was a awesome webinar. So I thank you from the bottom of my heart for all the things that you've told us. And I must thank the entire National Youth Wing team, which made this a grand success. I should tell you all congratulations to the entire team, because it is a huge success. And thank you so much. Thank you so much, Sanket, and thank you so much to everybody from MSSI who are participating. And we are sorry that we are not able to answer all the questions, but we were specific about the topic, and we wanted to stick to this topic. And we no I'm so happy that we did justice to the topic in answering all the important questions. In fact, I was telling Dr. Jaydip also the other day that when we first came out with the questions that we wanted to ask people, and we got around about 85, 86 odd questions, and we had to cut down to probably 11 or 12 because of the shortage of time.
11.
And 11 questions, because we didn't want the topic to the entire webinar to keep on extending of just answering questions. So that's why we had to we thought that these are the crucial points that we need to cover, and we covered that. And we are really grateful to you, Dr. Jaydip. Thank you so much. And thank you, everybody, for participating. Thank you.
Thank you, everyone.